Hello, Buffy Stinchfield here, physical therapist and women's health specialist. Today I want to talk to you a little bit about something called pelvic organ prolapse and the 5 signs that you really cannot ignore that could be symptoms of an early prolapse, and you really need to get it addressed. So I find it really important that we first talk about the fact that we all have pelvises, and we have 3 major organs that sit inside this area. We've got the bladder in the front, the uterus in the middle, and then the rectum goes along the back wall of the pelvis. These organs are held in place by ligaments at multiple levels inside the pelvis, and also supported at the bottom by the pelvic floor muscles, which you can see down there. So there are 5 things that you don't want to ignore, and they are: number 1 is feeling a sense of pressure at the base of your pelvis that you've not felt before. This pressure might change different times of day. It is likely going to feel more pressure at the end of the day, or if you've been on your feet or doing a lot of lifting. Don't ignore that. Number 2 is an occasional issue with urine leakage, like you cough and sneeze, or you do something like a big jump and you leak. Now, urinary incontinence is not a prolapse, but what that is a sign that your body is not able to manage the pressure inside your intra-abdominal area between your diaphragm and pelvic floor, so that when your diaphragm goes up and you sneeze, your pelvic floor muscles don't maintain the pressure there, and everything goes up and closes. What's likely happening is the pelvic floor muscles are going down while the diaphragm goes up, and so we're going to be leaking pressure. If we're leaking urine, we're leaking pressure. That means that the body is not managing pressure well, and that can mean an increased risk for you having organs starting to descend out the pelvis. Number 3 is incomplete emptying of your bladder or bowel. For bladder, usually you're going to find that a person sits down to go to the bathroom, but when they stand up, they find that they feel like they have to go more. They actually do sit down again, and more comes out. Having difficulty passing a bowel movement is also a symptom that potentially things have shifted inside the pelvis, and there's no longer just a straight shot for things to come out the rectum. And number 3 is intimacy and sexual intercourse is feeling different. Maybe you've never had any issue in the past with uncomfortable feeling or pain, but all of a sudden it just feels different. This could be a sign of things shifting inside your pelvis. And 5thly, we cannot keep a tampon in or a menstrual cup in. It seems to just shift its way down. That would be yet another sign of a pelvic organ prolapse. So if you have any of these 5 signs, I highly recommend that you see your doctor or your midwife, and I also highly recommend you work with a pelvic physical therapist specialist, because we're the people that can help you manage your pressures again, learn how to live safely with a prolapse, maybe potentially prevent that surgery, and at the least maximize your benefit from that surgery so that it doesn't fail. Surgeries do have a high failure rate of about 30% for some of them. So if you have questions, you can definitely message me here, and I hope you have a good day. Thank you.